Hello, fellow doctors. As you know, INICET is just around the corner, so I thought it would be the best time for me to put up some important points before the exam. Many of you must be giving this exam for the very first time, so a few pointers can definitely be helpful. Most of you must have heard that INICET is completely different from the NEETPG exam. Sorry to say, but that is true to an extent. So, I have compiled 5 points for you that you must keep in mind before appearing for the exam. INI subject focuses too much on previous year topics, far more than the NEET-PG. In this NEET-PG, there were many totally new questions, which were not the case for the May INICET, in which there were hardly 5 to 7 new questions, and most of them were anyways undoable. Leaving aside those 5 to 7 questions, the rest of the paper was quite familiar. I would say too familiar for comfort. I still remember after the exam, the online chatter was that the paper was too easy. But when the results came, everyone was shocked. The cutoff had fallen significantly lower than the previous November INICET. So, I hear you. What to do in such situations when the questions feel familiar but you are scoring less? The most important thing to do is to study those previous year topics thoroughly. Don't focus on the PYQs on its face value. Read everything there is to read about that topic. Also, don't fall for the trap that is recall bias. Maybe you have solved such questions in the GTs or in the question bank, but a similar looking question is not the same question. In the exam, treat every question as a new one. In last I-9, there were many questions with multiple statements in it, and the question would ask you to pick up all the correct statements, and the options would be A, B, C, A and B only, A, B and D, and C, B and D. Questions like this create too much problem. These create two types of problem. First, ruling out of option becomes too difficult, and second, it makes you more and more confused. So what to do in such type of questions? The best thing to do is to try to find the statement which is present in most of the questions. And if that statement is false, then most of the options become ruled out on its own. The examiners play it difficult here too. In some of the questions, no such option exists. You are left to wonder on a statement which is totally new to you and to guess क्या ये सही है या ये सही लग रहा है. You are totally on a prediction game. What I would suggest in such situation is just to go on the first instinct you have. Oftentimes, the most number of clicks that you make on the options on one question, the more confused you become, and the time runs out. Always have an eye on the clock and never ponder too much on one question. It's because one unanswered question is far better than leaving some question unattempted at the last. People often think that INI focuses mainly on the basic subjects, which is somewhat true, but subjects like medicine, surgery and obs-gynae remain equally important. The number of questions asked both in NEET-PG and INI from these subjects remain the same. What takes a hit are subjects like ENT and Opthal, which has 2 to 3 questions to the max. Subjects like Ortho also has less questions compared to the NEET-PG. So, what really to study? Focus more on the anatomy, especially on the images. Look for the cadaveric images. Go through the histology slides one last time. Look for the formulas in the physiology. Last time, tetanization frequency was asked. Also, PSM remains an evergreen subject. In PSM, biostats becomes far more important topic unlike NEET-PG. Many of us from peripheral colleges think that INICET is meant only for AIMS student. In fact, many of the students from my batch did not even appear for the last INI. This is a totally negative attitude. If you go into an exam with such kind of mentality, you have set yourself for a failure. And more importantly, try to think of an exam as if it is meant for you to succeed in life. This is easier said than done. But trust me, the question, what if I don't get my desired rank, often pushes many hardworking and knowledgeable people back. So, be more confident, but not casual. Even if you have done everything right, you have studied all the subjects in deep, gone through all the PYTs thoroughly, faced the exam with a positive attitude, and studied all the questions and options properly in the exam. Even then, INICET throws a curveball at you. In INI, you have to solve 200 questions in 180 minutes, which is less than the 210 minutes we are used to solving regularly. So, How to prepare for this? Try giving INICET based GTs at least 1 to 2 before the exam, and try to see that you give these GTs on a platform that you are not using currently. This will not only add up to your practice, but you will also face new questions which you are not used to in the previous GTs or the question bank. This will check your time efficiency better. Try to finish each set of questions 10 minutes before the time, because in the exam, nervousness and doubts will surely eat up your time. So these are some points I thought would be useful to many of you. I know most of you must be knowing many of these things, but to hear from someone brings you comfort. And worry not, this exam is meant for you. So gear up and push yourself for the final hurdle. That's all from my side. Do like and subscribe if you find my thoughts to be useful. See you in a future video. All the best.